After stance phase training has been successfully completed, the next step is swing phase training. The C-brace supports the user with high flexion resistance in the stance phase. To initiate the swing phase, however, the C-brace has to reduce this resistance in order to permit flexion, thereby guaranteeing sufficient ground clearance for the leg to swing forward. In order for the C-brace to initiate the swing phase and therefore permit flexion, the following criteria have to be met. A rollover movement from the heel to the forefoot, a forward movement of the thigh, a forward lean of the thigh, and knee extension, with extension moment. The basic prerequisites for the stance release are developed during stance phase training. It is important to shift the body's center of gravity forward over the leg with the orthosis and to place weight on the orthosis. Training with an exercise ball helps the patient gain a better feel for the swing phase. The patient stands in the stride position and kicks the ball using the leg with the orthosis. This kicking movement makes it easier to visualize the movement and helps the patient with the stance release. The C-brace provides assistance by emitting audible feedback when the stance release occurs. This function has to be activated in the Setup app. Pay attention to where and when the ball is hit. The patient should hit the ball in the middle, not on the side. This helps the patient learn to control the orthosis more effectively in the swing phase. The point where the ball stops gives the patient a feel for how hard the ball was kicked. As training progresses, the patient learns to release the stance phase with as little exertion as possible. This is important for walking efficiently in everyday life. Once the patient feels more confident doing the exercise, they can support themselves less with their hands. The goal is to perform the exercise without support. Even patients who otherwise walk with circumduction can usually successfully activate the hip flexors during this exercise. If no other option is available, the patient can tilt the pelvis to initiate the flexion movement. Unwanted initiation of the stance release may occur in certain situations. It is therefore important to practice the conscious stance release between parallel bars so the user is prepared for this everyday situation. For example, all stance release criteria may be met when climbing a step with the non-orthosis leg, while the leg with the orthosis is extended. This exercise helps the patient become even more familiar with the functionality of the joint unit.